So our main objective here of the fellowship program is to train pediatric cardiologists for the next generation. We want pediatric cardiologists to love what they do the way we love what we do. And we want them to have not only a passion for pediatric cardiology, but to have a curiosity about medicine, about their patients, and about pediatric cardiology. We are depending on them to be the next generation of pediatric cardiologists and to continue to move our field forward.
The fellows that thrive the most in our program are the fellows that work hard, they love cardiology, and they're the type of people that learn best by doing. The fellows will come in and have a kind of gradual progression of their education and curriculum during those 3 years. Our fellows will do predominantly clinical time during their first year, year and a half. As they progress through towards their third year, there's a lot more research time.
We're really keen on making sure the fellows are well supported in their research endeavors. There's a requirement for all fellows to complete a research project, an independent research project, in order to sit for the board, so we take that very seriously. We have a lot of resources available to us within the division to help fellows with their research. So we have a core of study coordinators who only work within the division. They are available to help everyone in the division with their projects, from the very beginning, kind of the idea generation phase, all the way to the end, to sort of publication and presentation.
We get to know our fellows get to know us, and we need to have that kind of personalized experience where we really work towards your goals and you're not just fitting into a slot. We're trying to make sure that we are doing what's best for our fellows to make sure that they're getting the education that they need and that they want for whatever career path lies in front of them. As a program that is large but not huge, you have help from all of our faculty members. Everybody is involved with the training of our fellows, and so you get to work with a lot of different faculty and see a lot of different facets of cardiology.
Our fellows will rotate through multiple different rotations. They spend a lot of time in the heart center taking care of the patients admitted to both the cardiac ICU and the step-down unit, which is called our transitional care unit. They spend time on echo, where they are both scanning patients and interpreting echoes.
I'm primarily a non-invasive imager, so I do all the cool and interesting imaging on kids' hearts. That includes echocardiograms, 3D echocardiograms, fetal echocardiograms, and cardiac MRIs. Being part of the virtual reality or 3D modeling or 3D echoes allows you to see the whole thing. You're putting together that mental image that is a bigger picture.
I've been a cardiology fellow here at Children's for 2 years now. I think you get to know these people, you work really closely with them, you work really hard with them. And so in that way, it's really nice to go through that kind of experience together. We have great program directors that facilitate a lot of social events for us as well. We usually try to get together once every month, once every other month.
We generally just are on each rotation 1 week at a time, but we can be on service here in the Heart Center during the day, at night, over in the CICU during second and third year of fellowship, and then there are lots of other rotations where we basically learn the core concepts of cardiology by delving into that team for a week at a time throughout the year. St. Louis is great. It's a pretty easy place to live. It's affordable. There's lots of free activities. There's lots of parks and green spaces you can go enjoy. I live walking distance from the hospital. I think that makes my quality of life a lot better during fellowship, that I can be like out the door 10 minutes before I need to be at work. But there's also, tons of different options if you want to live in a more city environment or have a house in the suburbs. Those are definitely options as well.
All of our faculty are really invested in our fellows and in the fellows' education as cardiologists, but also in them as people and making sure that they're getting what they need in order to thrive both inside the hospital and outside the hospital.